Knowledge of dentin is key in appreciating the significant attention dedicated to adhesion technologies in recent years. Dentin is a moist biological complex, the weight of which is composed of 70% inorganic material, 50% by volume, 18% of organic matrix, 25% by volume, and 12% water, 25% by volume. Most of the organic content of dentin is composed of collagen type 1. The most distinctive structures of the dentinal tissue are tubules, which represent traces of the odontoblast cells of the dentino-enamel junction of the pulp chamber. The tubules converge in the direction of the pulp. The number of tubules is less at the dentino-enamel junction and gradually increases toward the pulp chamber. Density is approximately 15,000 square millimeters for superficial dentin and 45,000 square millimeters for deep dentin. The preparation of the cavity with a rotating burr or other instrument forms a debris layer on the prepared surface called the smear layer. The layer is made up of hydroxyapatite debris and altered, denatured collagen of 0.5 to 5 micron in thickness. The smear layer blocks the openings of the dental tubules with plugs, thereby decreasing the permeability of the dentin by up to 86%. Orthophosphoric acid etching between 35 and 37% allows a deep action of demineralization and removal of all intratubular debris, improving penetration of the hydrophilic monomers. One side effect of using acid etching on the dentin surface is an increase in the substrate permeability caused by the elimination of the overlying smear layer. Both the emission of dentin fluid and the presence of water used for rinsing make the treated dentin extremely moist and even wet. Water plays an important role in the mechanism of adhesion and represents the most difficult variable to control. Its job is to sustain the collagen fibrils no longer reinforced by the mineral component dissolved by the acid. Etched dentin, unlike enamel, has purely hydrophobic characteristics. All the hydrophilic monomers contained in the primers have been found to interact with the dentinal structures in a moist atmosphere. For years, researchers have considered this moist atmosphere indispensable for the efficacy of adhesive systems. The optimum degree of moistness has been and continues to be an unresolved challenge. Drying the etched dentin with an air jet considerably decreases the resistance values of the bonding, especially in the case of dentin adhesives containing acetone or ethanol. Removal of water can cause a loss in the elasticity of the collagen. During air jet drying, the water that occupies the interfibrillar spaces, previously full of hydroxyapatite crystals, evaporates, causing the collagen network to drop in volume by up to a third of its original dimensions, thereby preventing the monomers from penetrating the surrounding area. The quantity of water needed to prevent a collapse of the collagen fibrils depends on the depth of demineralization obtained in the etching phase, usually about 3 to 7 micron. Adhesive agents with monomers that are more or less hydrophilic, as well as different solvents, necessitate careful hydration of the surface. Adhesive systems, including organic solvents, acetone or ethanol, can be used on moist dentin because they're able to move the water from both the dentin surface and the moist collagen fibrils. The solvents induce the infiltration of the resin monomers through the nanospaces of the dense collagen network. It's been repeatedly demonstrated that the wet bonding technique improves the resistance of the bonding because the water keeps the porosity of the collagen network open, thereby allowing the monomers to interlock. This procedure of using water or an aqueous solution has been shown to restore resistance to the bond and to counteract certain characteristics of the collapsed collagen network to levels similar to those of the wet bonding technique.